Now, follicular tumors, like I said, have kind of a constellation of features. Blue basaloid cells, often with peripheral palisading, and because of that, they can resemble pretty closely sometimes basal cell carcinoma. But the key to me that really helps is the stroma and the way the tumor islands interface with the stroma. Here you can see the stroma is this kind of dense, pink, collagenous, kind of more cellular stroma, and it tightly hugs the nests. There's none of that clefting artifact with mucin-filled space that you usually see in classic basal cell carcinoma. And additionally, if you're lucky, you'll find these structures with the green arrows highlight. These are papillary mesenchymal bodies. These are kind of round to oval stromal cells. I know they look round, but if you did a keratin, the blue islands would stain, but if a keratin immunostain would stain the blue islands of epithelial cells, but these cells are actually stromal cells. They are not epithelial. They are a specialized stroma that's recapitulating the stromal cells that you see around the hair root or hair bulb, which normally kind of regulate and control hair follicle growth. And so when you get certain hair follicle tumors, like trichoepitheliomas particularly, you'll tend to see these little structures. And sometimes they're big and beautiful, like this is the best ever example. Other times they're little tiny things. So this is a really good classic example to learn what papillary mesenchymal bodies look like. They're all clustered and kind of pushing right into and almost invaginating into those blue islands of basaloid cells, but sometimes you won't see that perfect cut. So you'll see this is a papillary mesenchymal body, but because of the angle of the section, and you can't actually even see the island of basaloid cells. It's like this island here would be like a cut straight across here, basically. Or other times, like I said, they're just this tiny, tiny little aggregation. So once you learn the classic ones, then you can begin to recognize them when they're much more subtle, kind of incipient papillary mesenchymal bodies. And that can be a really, really important clue for not only recognizing hair follicle tumors, but even recognizing little immature vellus hairs that sometimes, particularly at margins or on frozen sections, sometimes those can be a close mimic of a little island of basal cell carcinoma. So I've many times seen, residents and trainees particularly make that mistake and think something's a bit of basal cell carcinoma when in actuality, it was just a little tiny hair follicle. Like I said, follicular tumors, they have this stroma, and the stroma tends to be more cellular, and it tightly wraps and hugs the nests. It just wraps right around those nests, just like the stroma, the adventitia, which is the name for the stroma around normal hair follicles, just like that tightly hugs the normal hair follicle. So here, the cellular stroma of a hair follicle tumor tends to tightly wrap around the basaloid epithelial islands. And here's a contrast. This was a trichoblastoma over here. And in contrast, this is the kind of stroma in basal. There's this separation with mucin or myxoid material, whatever you like, bluish substance in there in that crack between the palisading and the surrounding stroma. So you'll often find that, not every basal, but many of them have that, and it's a very helpful feature.